inspiration for the CLOTS program started one night after a lecture that we both attended. The food was good. We had lots of good company, and we were just sharing our experience about looking after patients. And one of the things we shared was that we were concerned that patients usually didn't know what the signs and symptoms of blood clots were, and that often just led to, delay in diagnosis, and then that sometimes leads to, a bad outcome. So we thought, stroke program has such a great acronym, FAST, to help people understand or know what the signs and symptoms are, that it would be great if we have a similar program, an acronym that allows people to remember what the signs and symptoms are. So we thought something fast, short, easy to remember. We thought, well, something like CLOTS would be great, right? So Deb and I, we were just really shooting the breeze, kind of say, hey, you know what? For C, we could have chest pain. And so we just started sort of talking about it, and there you go. So the whole thing really came about organically, and it was great to develop it. So we didn't sit down to say, hey, this is what we need to do, but yeah, it just happened.
We included 5 signs and symptoms in the CLOTS acronym because these are important signs and symptoms that might indicate that a blood clot is present. And these blood clots can be either a blood clot in the lungs, which we call pulmonary embolism, or a blood clot in the veins of the legs, which is called a deep vein thrombosis. So these are common symptoms that are experienced by patients who have blood clots. We wanted them to be included so that people would know what to look out for and to seek medical attention if they happen.
C is for chest pain in our acronym, and chest pain can occur in people with blood clots to the lung, especially if the lung is inflamed or injured as a result of the blood clot. Now, chest pain can also occur in other conditions like a heart attack or pneumonia, but this is fairly common knowledge. Like most people would know that, if I have chest pain, this might be a heart attack. So we also want people to know that chest pain can be a sign of a blood clot in their lungs as well. So just to add that, knowledge so that they can seek help when it develops.
So L in our acronym stands for lightheadedness, which is a less common sign of pulmonary embolism or blood clot in the lungs, but it is an important one. In a person who has a blood clot in the lungs, this could mean that there isn't enough blood flow going to the brain, and so the person feels lightheaded or like they're going to pass out or faint. It's important to know that people can feel lightheaded for lots of reasons, but when a person has a blood clot in the lungs, it's actually very important because it could be very dangerous. We encourage people, if they have lightheadedness, especially if it occurs in the context of other signs or symptoms like chest pain or feeling out of breath, that could be something serious and to seek medical attention urgently.
O is for out of breath in our acronym, and this is probably the most common presentation in somebody who is having a pulmonary embolism or blood clot in their lung. We chose out of breath as opposed to shortness of breath because a lot of people will describe that they may have a difficulty taking a full breath, or if they feel like might be a pressure on their chest. So it's not so much shortness of breath because they're panting away kind of thing, but they just don't feel like they're taking a deep enough breath. So we want, folks to be aware that, again, being out of breath is a common presentation of a blood clot in their lungs.
T in the CLOTS acronym stands for leg tenderness or pain. And this is, of course, a classic symptom of people who have a blood clot in the veins of the legs or deep vein thrombosis. But there are lots of reasons that people get leg pain. So it's sometimes a symptom that people may overlook because they think it's from something else. It is important to know that leg pain or tenderness, especially if it's in the calf muscle, it might feel like a dull ache or a heaviness. Sometimes people will describe that it's hard to pinpoint exactly where it hurts. It's just a generalized ache. And it's persistent, so it doesn't go away. And it will probably be different than other types of pain that people have for other reasons, like arthritis. If this type of pain happens and it's persistent and otherwise unexplained, especially if it happens in the context of other symptoms that we're going to talk about next, like swelling or redness of the leg, this could mean that there is a blood clot and people need to go see a doctor.
So S is for swelling and is the last letter in our acronym. And leg swelling obviously is common in lots of conditions, including blood clots in the leg. So the leg swelling in somebody with deep vein thrombosis or DVT will often just occur in one leg as opposed to both legs. Swelling in both legs could be in heart failure, in kidney disease, but whereas in patients with the DVT, deep vein thrombosis, this is usually just in one leg. Now the swelling may get better with elevation, but that happens in a lot of conditions as well. But I think that the unilateral presentation is really a key. And again, if somebody develops swelling in only one leg, they really should see their doctor and have this investigated to see if this is deep vein thrombosis.
So now that we've gone through the CLOTS acronym, which stands for chest pain, lightheadedness, out of breath, leg tenderness, and leg swelling, you can see that these are the most common signs and symptoms of blood clots that happen in the deep veins of the legs, called deep vein thrombosis, or pulmonary embolism, which is a blood clot in the lungs. We wanted to help people remember these signs and symptoms so they could seek medical attention and get early diagnosis and treatment. We wanted people to be able to recognize these symptoms for themselves, and also for their family members or friends who are experiencing symptoms as well. What we have seen in clinical practice is that people often have signs and symptoms, and they're not sure what to do. So that was one of the reasons that we developed this program, is to help with that.
Yes, and I mean, often in our clinic, we will, I'll hear that, oh, you know what, I wasn't aware that I was short of breath, or I didn't really notice my leg is swollen, but it was my wife, my husband, or somebody else, a friend who pointed out, hey, you have this, maybe you should get it checked out. So again, being aware of these signs and symptoms, it's important to help ourselves, but also our loved ones, because, these conditions could be life-changing, even if not life-threatening. So we want people to be aware, to be knowledgeable, so they can help themselves and others. So we hope this is useful. We think CLOTS is easy to remember, and it really does highlight some of the most important signs and symptoms that patients can have when they have a deep vein thrombosis or pulmonary embolism.